Good morning, good afternoon, good evening, wherever you're listening from. My name is Onyewoman Nemeka. I'm the grant holder for the Astro-prison project in Nigeria. The Astro-prison project is an initiative aimed at using astronomy to reorient the prison inmates and also bequeath them some skills that will help them after life after incarceration, following the Prison Reform Act enacted in Nigeria in 2019. Now, the project has the following goals: to inspire, educate, and prepare inmates for a life after imprisonment using astronomy. And we did this project in collaboration with the Carmelite Prison Interest Organization and the Mekachi Agro Foundation. Now, during the project, we bequeathed the inmates with skills such as snaring and beekeeping. And also, we introduced to them the concept of pale blue dot as a means of reorientation to help them in ethical change behavior. Also, during the project, we conducted medical outreach, during which we brought medical professionals who gave them treatments of various, from their various ailments, and also gave them drugs, as this is one of the important things you can do for people within incarceration. And this project was conducted in 2 locations instead of 3, the Enugu Maximum Security Prison and Nsukka Minimum Security Prison. We couldn't get to Oji River because we didn't get additional funds. The donors we hoped on couldn't remit some funds to us, so we limited it to 2 locations. Now, the intended outcome of this project are raise the literacy level of astronomy education within the correctional centers. Now, we didn't go there to teach them professional astronomy. We went there to give them information about astronomy as it concerns humanity and our coexistence and the need to shun crime, and also see each and every individual as a brother and as a sister. So we did this using the concept of pale blue dot. And also, this project will help the federal government in their Prison Reform Act, at least helping them, the prisoners, to have a change of mind, to shun crime and embrace good living. And also educate the prisoners and the warders on what to do and how to follow up to ensure that the current pandemic, COVID-19 pandemic, did not catch up with them, and also give them medical treatments of from their various ailments. Because when we visit the prison, you will definitely know the importance of free movement, and because you can easily go anywhere, get medication and what have you. But down there, you only get medication when programs like this are organized or when the medical doctors on duty come around. And then also boost the morale of the inmates to let them know that after incarceration, there is still a lot to live for. During our consultation with the controller of prisons, he made us realize that some inmates prefer staying in the prison to going outside, especially when they must have spent a very long time in incarceration. They will tell you, if I go out there, what will I be doing? I will start struggling for job opportunities when I have spent over 20 years. In fact, I don't even know where to begin. So they prefer to stay back in the prison instead of going out to struggle. So if we, by giving them these skills, it's a means of boosting their morals so that when they go there, they will know that, yes, there's something I can still do to survive. Okay, so we address the following UN developmental goals: no poverty, good health, peace, justice, and strong institutions. And these goals were addressed using, the first one was addressed using astronomy skills acquisition, the concept of pale blue dot. The second one, which has the first one was addressed using skills acquisition by giving them necessary skills that they can fall back on when they leave the prison. The third one was addressed using the medical outreach we conducted. The goal 16 was addressed using the concept of pale blue dots. Now, this is a picture of one of our consultations with the controller of prisons in Enugu State. This is the controller of prisons in Enugu State. This is the director of Camlet Prisoners Interest Organization, Reverend Father Jude Isiguzo. And this is the director of CBSS, Dr. Bonaventure Okere, and the other team members. So we conducted a series of consultations with the prison authorities, because it's a place that you don't go in when you like. They must have to schedule you, and it must be a time that is convenient for them. So we chose between 16th and 20th of August 2021 to conduct this project. And then during this period, the prisons are on, the courts are on recess. So every inmate is available for training. Now, at the Enugu Maximum Security Prison, we had over 2,000 prisoners there, and we couldn't reach out to all of them. About 100 plus was reached out to, both for the medical outreach and for the skills acquisition, because the number is enormous on a plot of land, on a space of less than 600 square meters. So these are the activities we conducted there. We introduced astronomy to them first, using the concept of pale blue dots, educating them on the need to change from bad to good, and on the need also to forgive and see each member of the society as his or her brother, and the need to preserve the society. Then we conducted the medical outreach. Now, during the medical outreach, we attended to over 130 inmates, and we had in our midst about 7 medical professionals, doctors, pharmacists, nurses, and also we provided COVID-19 protective gears for them as well. Now, unfortunately, you cannot see the picture of these activities, because within the prison, electronic gadgets are not allowed. You can't snap pictures, you can't take recordings. In fact, you only do what they ask you to do. And also, we realize that in the prison also, you don't make certain comments, because they try to avoid stampede. Once there are stampede, there is bound to be jailbreak. So we are just very cautious of what we do in the prison. So we follow laid down rules. Then the other thing we did was to conduct entrepreneurship training for the inmates. The entrepreneurship training we conducted was for snail farming and beekeeping. After the training, we established 2 farms at the maximum security prison, one for the female inmates and one for the male inmates. And then at the Nsoka prison, we established one, because it is basically, that place doesn't have female inmates. So we established one snail farm for them, and stocked it with snails and feeds for the snails too. And then also we distributed toiletries to the inmates. We made sure that we had toiletries that went round to the 2,000 plus inmates at the maximum security prison in Enugu. Both the male and the female inmates had toiletries, soaps, and the female inmates also have toiletries, their special needs. Okay, so we also went out of our way based on the request made by the inmates and also the authorities at the prison. We had to sponsor their football competition. The sponsorship is not much. We sponsored them to get more footballs. At least that will help them to get over the period of incarceration, because between July and August, they normally have their football competition for the different prison hostels. So they organize football competition between July and August. And as you can see, these are the medical team that delivered the medical outreach. And also these are some of my team members, some of the toiletries and the feed for the snails we also delivered to the inmates. And also during the program, we had to feed the prisoners. One funny thing we realized is that once a program like this is going on, especially when it comes to distribution of drugs, distribution of food, almost all the inmates are interested, because this opportunity, like I said before, comes once in a long while. So I want to thank OAD for sponsoring this project, and we wish that we also conduct this project in other facilities around. Thank you very much, and do have a wonderful day.